Okay, so we're looking at the four components of psychosocial health. So we're looking at intellectual health, emotional health, social health, and spiritual health. So first of all, we'll start off with intellectual health or the thinking you. So intellectual health describes the thinking or rational part of psychosocial health. It's the ability to reason, interpret, and remember from a unique perspective. This is how you sort through information, attach meaning, and make decisions. It's the ability to take responsibility for actions and deal rationally with the consequences. Intellectually healthy people enjoy life, the environment, and the people in it. When a person's intellectual life deteriorates, he or she may experience sharp declines in rational thinking and increasingly distorted perceptions. Those negative reactions might threaten the quality and quantity of life. And people showing signs of extreme abnormal behaviors are classified as having a mental illness. The next component of psychosocial health is emotional health or the feeling you. So emotional health refers to the feeling or subjective part of psychosocial health. So what are emotions? Well, emotions are intensified feelings or complex patterns of feelings that we experience. So this can be everything from love, hate, hurt, despair, joy, anxiety, fear, frustration, and anger. These are all some of the emotions that we experience. Typically, emotions are described as the interplay or the combination of four components, which are physiological arousal, feelings, cognitive or thinking processes, and behavioral reactions. And there are four basic types of emotions that come from these components. So they are emotions resulting from harm, loss, or threats, emotions resulting from benefits or rewards, borderline emotions such as hope and compassion, and more complex emotions such as grief, disappointment, bewilderness, and curiosity. And of course, you can experience these emotions in any combination at any time. Emotionally healthy people are able to respond to these emotions in stable and appropriate ways. When you're emotionally healthy, you're essentially less likely to let your feelings overpower you. And poor emotional health can often affect the next component of psychosocial health, which is your social health. So poor emotional health can lead to poor social health. And as a result of that, you can have social isolation. And social isolation is one of the many potentially negative consequences of unstable emotional responses. The next component of psychosocial health is social health or your interactions with others. So social health refers to our interactions with others or our ability to use and to provide social resources and support in time of need and our ability to adapt to social situations. There are two factors that are important to our social health. So the first is the presence of social bonds or social linkages. And this refers to our social bonds refers to things like intimacy, feelings of belonging to a group, opportunities for giving and receiving nurture from other people, reassurances of one's worth, assistance and guidance and advice. In general, the more connected you feel to others, the better you're able to manage your stress and the more resilient you are in response to life's crises. The second factor that's important in social health is the presence of key social supports, expressive or structural. So this means things like your social supports could be things like emotional support and encouragement, and your structural support could be things like housing and money. Your social support can come from friends and family, or it can be provided by professionals in different types of settings. Socially healthy people have a wide range of social interactions with family, friends, acquaintances, and individuals, and they react without prejudice to those around them in their day-to-day transactions. So the next component of psychosocial health is spiritual health. And Another way to say it is an inner quest for well-being. So you may not think of yourself as a spiritual person, but spiritual doesn't necessarily mean religion. Spiritual health refers to the search for meaning, connectedness, energy, and transcendence, rather than simply a connection to a particular religion. Spirituality refers to the deepest or innermost part of you, the part that helps you make sense of the world and your part in it. Your spiritual health may involve a belief in a supreme being or a specified way of life as prescribed by a particular religion, or it may relate to personal relationships or being at peace with nature and yourself. Attaining and maintaining spiritual health does take time and experience. And spirituality addresses four main themes, which are interconnectedness to yourself, others, and possibly a larger meaning or purpose. The practice of mindfulness, or the ability to be fully present in the moment. And spirituality is a part of your daily life, and giving you a way to articulate your purpose in life and the feeling of joy and love, peace, and fulfillment. And it also addresses the theme of living in harmony with our community. So you can see those four main themes that relate to spirituality here. So a little bit more about spiritual health. So studies of spirituality among post-secondary students indicated that spirituality played a role in their health, their grades, and other aspects of their student life. And it's also been found that more spiritually oriented students had better health, higher grades, and more involvement in charitable organizations or volunteerism, and more interest in helping others. A spiritual resurgence refers to an increase in spiritual awareness, but it doesn't necessarily equate with an increase in beliefs in a God or a supreme being of some kind. Spirituality can refer to a quest for learning about yourself. One of the most important things needed to develop one's psychosocial health is to give yourself time to pause and reflect upon life. So some strategies for finding your spiritual side could involve volunteering, and this can help you recognize that you're part of the greater system of humanity and that you have a role and responsibility to help others in your community. Can also can also involve taking time to reflect. So connecting with yourself is another method that can help you find your spiritual side and can help you manage stress. And it can also be getting involved with service learning. So this could involve finding meaningful and productive contributions and relationships within your greater community.